Hello everyone and welcome to another ACOM Health Tools for Success presentation. My name is Dr. Craig Burko. Today's topic is the subject of encounter notes. And as a chiropractor myself, this really hits home. After many years of being in practice, both staff and a chiropractor should know whether there is an issue in regards to encounter notes. The issue can be several issues. There could be an inability to keep up with the encounter notes. There could be additional documentation that's needed by payers, and the doctor is always having to keep up with that issue. Perhaps there's never enough time to do encounter notes. So the important issue here is that staff and chiropractor must work together to, number one, recognize this issue, and number two, to do something about it. But today's topic, encounter notes, we'll go over, is this a problem happening in my practice? What causes this important issue? How to fix it? And how can technology help? Again, I share with you from a chiropractic standpoint and from many years in practice, as a chiropractor, you have to recognize if you have an encounter notes issue. And again, it could be you're always falling behind with your encounter notes. You're always doing the encounter notes on your weekends or after work, on your lunch breaks. Listen, you could just look at your desk. Your staff can look at your desk. You can look at your desk and know whether or not is this happening in my practice. Staff can provide you daily and weekly posting reports of billing that has gone out. And I can tell you this from my own experience, that if there is a decrease in the amount of billing that goes out, a lot of it is in sync with being behind in encounter notes that must be provided to the staff in order for the staff to do their job. One thing for sure, staff and doctor must work together on this very, very important issue. If your staff doesn't bring you patient files to complete, that's an issue all by itself. Again, staff and chiropractor must work together on this very, very important issue. I will tell you this. One of the things that I have learned of what may be causing this specific issue is the workflow that you have put upon yourself in the office. Do you even schedule time for you to do encounter notes? Whether it's with the patient when the patient is in front of you, or do you schedule enough time to do patients after the patients leave? A lot of the problem with encounter notes that I've seen over the many years is something as simple as making sure that you provide yourself enough cycles and time and the workflow in order for you to conclude these encounter notes. Staff workflow, your staff has to have the time to recognize when the doctor needs patient files to complete the encounter notes. They can't get behind in providing you these files, otherwise the doctor's workflow is going to be backed up even worse. So I can't say it enough from my own experience that the doctor and staff must work together here. A lot of it has to do with a workflow issue, and that needs to be fixed in order for there not to be an encounter note issue. An issue that that I recognized in practice was perhaps there's also a lack of proper tools in place. Those tools can be as simple as what is the note system that's being used? Is it too complicated for the doctor to fill out according to perhaps the level of clinical expertise? If, for example, is the doctor just doing chiropractic adjustments, or is the chiropractic office doing chiropractic adjustments plus licensed massage therapy, plus active therapies, plus passive physical therapies? Of course, depending upon the type of practice and what's being utilized, what procedures, can also determine the type of notes that are necessary for the chiropractor to complete their encounter note. Perhaps the notes are too complicated for the methodology, for the procedures that are being used. So again, lack of proper tools, very, very important subject. How do we fix this issue? Well, I think one of the first things is staff and doctor must recognize that whenever there's an encounter note issue in the practice, whatever the encounter note issue is, staff and doctor must recognize that it's going to absolutely have an impact on the cash flow and revenue of the practice. And without the proper tools, it will also have an impact on the cash flow and revenue on the practice. ACOM recognizes that technology and automated encounter notes is not for everyone, but we are a believer that software automation can help manage your practice much better. You may only want to do paper notes for the rest of your practice life, and that's fine. We can tell you that thousands of chiropractors nationwide have improved their workflow, have improved their bottom line, and have run a happier practice for both staff and chiropractor when they've incorporated technology, especially technology in regards to software for encounter notes. And again, you may still wish to stay with paper. Of course, that's up to you. But an automated system equals a better managed care practice. And when there's automated alerts to alert you to do patient files, which can be a function of your software, again, you'll have a better managed practice. We invite you to call one of our many practice consultants that work for ACOM for you to share with them some of your practice challenges, and perhaps you do have an encounter note challenge in your practice. We have many chiropractors on staff who understands the wants and needs of today's chiropractor. You're more than welcome to accept our invitation and give them a call and let them share with you the best practices that we know of. And again, software and automation may not be for you, but we have seen thousands of chiropractors nationwide who've been helped with software automation. ACOM Health's toll-free number is 866-286-5315, 866-286-5315. Thanks so much for joining us on another ACOM Health Tools for Success presentation.